This is perineal massage instruction. So you or your partner can take a clean finger with a clipped fingernail, and you have the option to use some lubricant if you'd like. What you're gonna do is insert just about the tip of your finger, maybe toward the first knuckle, into the vaginal canal. Start with a little bit of a downward press right toward that 6 o'clock spot, and maybe push just slightly into a little bit of tenderness. Don't make it terribly painful, but just into a little bit of tightness or tenderness, and then take some deep breaths. As you take some deep breaths, you should feel these muscles kind of expanding and almost opening toward your fingers. And then as you exhale, you should feel the muscles gently recoil back up toward your head. So you're gonna hold that downward pull at that 6 o'clock point as you take a couple deep breaths. Now that tenderness should fade away and lower, and you might end up adding a little bit to that stretch, or turn your finger and get a new angle there. So you can go ahead and stretch and breathe into 6 o'clock. You can also then stretch and breathe into 5 o'clock, 4 o'clock, 3 o'clock, and you can sort of go around the whole opening. So again, I would recommend don't make this more painful or tender than about a 3 out of 10. Hold the spot, be really patient, breathe into it, feel for the softening of those tissues, and then move right along. This is something that you can start doing a few days a week, maybe 3 days a week or so. Sometimes it can feel a little bit tender or sore as you get started, but most people report that it feels pretty good as they keep going with it, no major complaints. So it's just one preventive strategy for tearing during delivery.